Individuals residing in historically marginalized communities often experience barriers with healthcare, not just with healthcare, but it's utilizing the health system as a primary care. And as a result, a lot of them incur a lot of debt that prevents them from being able to rise from crisis to thriving.
Solutions to inequities live with the people who experience them. Unfortunately, they don't have power or access to be able to inform the solutions that are being driven by people and institutions and systems with more power and more access.
Breaking the cycle requires that we have individuals with lived experiences at the table as members of focus groups, members of advisory councils, so that they can share exactly how it is on the other side of the healthcare system.
It's essential to work alongside community members when we do systems change work because they provide expertise in the daily impacts and implications of policies that we are looking to change. So they can give us this valuable perspective of how their lives are impacted or how they are experiencing the good, the bad, and what may need to be changed. And then from there, we can actually build solutions that will work for people and human-centered systems.
It's really important that we understand that in a context of health inequities where there are structural inequities, those of us who have power and privilege can actually do something to the systems that are getting in the way, the barriers that are getting in the way for people to live their best life possible. Well-being and equity in the world, or we in the world, we're working to build a movement of better ancestors. We can't change the past. We've inherited the world we live in today. But we can understand how we got here, and we can choose to be better ancestors that creates a path forward for the next 7 generations.
Communities Rise came about as a partnership not of any one organization, but a network of over 12 partners who each collectively lead major networks.
For me, RISE was a huge movement late in my career to understand that so many of us had come through systems that were not equitable, that were not shared leadership and shared decision-making. And having that experience made me much better at looking at what my community might need and what it is that I could bring to that conversation.
Being around the RISE people, they teach you these vocabulary skills, which I use and love. That's absolutely amazing. They made us be able to connect outside of our state and have meetings and technology that we didn't have really before or have access to before. Now we all can, and we can collaborate and share ideas from afar.
To harness the interest, the power, and the commitment necessary to change health inequities requires us to make the case. People need to smell it, taste it, feel it, touch it, hear it to know that it's real. That's why data are really important and an important part of finding solutions.
Data can definitely let the communities know what zip codes are not thriving. It can let them know if there are high risk for chronic diseases. Data is so broad and it encompasses so much, and it can get them to the root of where the work needs to begin in the community.
One of the things that really enabled the work of communities across the country in Communities Rise Together was something we called our Data for Power initiatives, which is the understanding that people in communities deserve to have the data they needed based on their priorities to drive the response.
It started off with the COVID-19 vaccine hesitation. There's a lot of data, quantitative data that we can gather, but how do we humanize this data? We went and did one-on-one surveys with people in the community. The qualitative stories that we get, you have more understanding versus, oh, these people aren't healthy. And this was from the tool that RISE provided for us.
We created jobs and we trained that workforce, over 3,200 to date. to not only reach out and connect people to vaccines, but to understand the well-being of their communities, to use their data to strategize about what would improve the lives of their fellow community members.
I've witnessed the teams do the footwork, going door to door in the community, letting the community know that they were the key to success. We walked through what it looks like to not only invite someone at the table, but also trust them, trust their lived experience, and trust that they have the answer on the inside of them.
Everyone should see themselves as a contributor to the health and well-being of the public, because we're all in society together. And where we have deficiencies in one area or another, it affects all of us. And so being able to address the root cause of it will make a better world and a safer world for everyone.
When people contribute to their community's health and well-being, what we see is a dismantling of a false hierarchy of human value.
To us, equity is a path toward justice, but also toward joy and liberation. And that's the world we want to live and be a part of building.